So I want to thank Granite Task and the YMCA, as well as Cassie and Carissa, for really helping to facilitate this, and I want to thank all of you for coming. It's much more exciting to give these talks to people in addition to ICTV at the same time. So February is the National Heart Month. And so I wanted to do just a general talk on the heart because it's so important for your health. In fact, it's vitally important. And the reason that I mention it in this way is there's only a few organs in your body that have such a large impact on the whole rest of your body. So your heart and your cardiovascular system is really the thing that keeps supplying your body with energy. And you know, the interplay between these things, if your heart's not working well, it can make it very difficult on your lungs and on your brain and other necessary parts of your body. So it's really important that we try to keep this healthy, not only just for the heart itself, but it can also be something that we can use medically to overcome maybe a disease of your lungs. If your heart's working well, we have a lot more options versus once you start having a few things go on, it gets much more difficult. So one of the first things I wanted to discuss is I hear people all the time that talk about heart attacks, and obviously they're very concerning to people to have a heart attack because you don't always get symptoms that lead up to them, but very few people kind of understand the process that happens to lead up to a heart attack. So I wanted to just kind of go through this. So what happens at first is that things in your bloodstream called LDL deposits basically start to form a layer inside the lining of the inside of your vessels. Your body then tries to get rid of these by sending its killer cells that come in and basically try to grab these LDL components and get rid of them, but in the end they create these larger foam cells which build up and form a thicker lining on the inside of that. Eventually, with more inflammation, this gets larger and larger and develops kind of a thin capsule that forms over the top of it. Now at this stage, sometimes people will have something that we call stable angina when you're out exercising or doing something, you'll get symptoms of chest pain, shortness of breath. Those are really kind of shots over the bow that something's going on. But for most people, there actually won't be any symptoms yet. Then what can happen is you can have this plaque rupture because again it's got a thin layer over the top and these fragments can go downstream, and the really concerning thing that leads to what most of the heart attacks that you know people get, especially the ones that are abrupt and kind of without warning, is that you end up getting a blood clot that forms around this area of the inside of your lining of the vessel where the rupture happened. When this happens, everything downstream can't get proper blood flow, and that's when the heart attack happens. So really it's muscle that can't get blood flow from your heart that if left too long will actually die. Common signs of a heart attack is chest discomfort. Usually it feels like an intense pressure. People will talk about an elephant sitting on their chest or just a lot of tightness in their chest. Squeezing type pain feels like somebody's just kind of squeezing right through their chest. Usually it lasts for a few minutes. Sometimes it can come and go. Sometimes the pain can extend beyond your chest though, and this is because the nerves on the inside of our body are not as specific as the nerves on the outside of our body. So on our fingers we can feel things very finely, which finger, where it is, and what it is. But the nerves on the inside of our body aren't quite as well developed, and so a lot of times when people will have heart pain, they'll actually develop jaw pain, arm pain, sometimes back pain, sometimes stomach pain. And so it's important to think about some of these other components that could actually represent your heart not getting enough blood flow. If you have shortness of breath, even if you don't have chest pain, sometimes that can be from your heart. So if there's really no other reason for it, and especially if you notice this happens when you're exerting yourself, that can be another warning sign. Less common, but still potential symptoms are cold sweats, nausea, vomiting, lightheadedness, anxiety, indigestion, unexplained fatigue. I have a lot of patients that will end up going to the emergency department with these symptoms. Now keep in mind these symptoms happen for a lot of things other than your heart as well too. But like I tell many of them after they go to the emergency department just to find out that it was not their heart, that this is actually really good news. It doesn't mean that they shouldn't have went to the emergency department. It doesn't mean that anything was done wrong. It's actually a good thing that despite you know, them having some concerning symptoms, we found out that wasn't their heart. So when in doubt, I would definitely advise you to go check it out. If it's something that's been going on chronically, you probably would be able to go to your normal office doctor. But if it's something that's new or really concerns you, I would not chance it and wait until the next day. So what should you do if you have these symptoms? If you have crushing chest pain, with shortness of breath, the first thing you should do is call 911. Again, I've had a lot of patients that would try to drive themselves or wait. Time is heart muscle. What I mean by that is when you lose blood supply to part of your heart, those muscle cells will start to suffer, and if they die, they can't really be regenerated. So the most important thing is to seek medical attention right away, and the quickest way to do that is to call 911. Even if you're in a situation where you feel like you could beat the ambulance to the hospital, 9 out of 10 times it's best to have the ambulance come to you, because they're going to start treatment from the minute they get there, and if halfway to the hospital you lose consciousness, not only will probably no one ever know that you tried to get to the hospital, but you could hurt somebody else on the way there too. It is beneficial to chew a baby aspirin. That's the 81 milligram aspirin. So if you're concerned about this, I would definitely do that. It would be very rare to have an issue that would make it so you should not have aspirin, but hopefully if that is the case, your doctors talk to you about not doing this. It can also be really important to develop a heart plan with your doctor to say, okay, if this happens, what do you want me to do with my specific medical history that might be different than what you might find on the American Heart Association website or what I'm talking to you about. One other thing that I think is incredibly important, we are fortunate in Grand Rapids to have almost all of our medical records within one system. But in many places, they're not that fortunate, and there's many times where you might be in an area outside of Grand Rapids. Really important, if in your wallet you keep a little card that just has a few simple things about your health history. Your name, who to contact if you can't communicate with whoever's providing you health care, the medications you're on, and any allergies is a great start. If you have any major medical issues, and again your doctor can kind of help you figure out what's major medical issues, that's helpful also. I wouldn't clutter up the card too much, but a few of those things can be incredibly important if you're in a position to where you can't communicate as you normally would. The other thing that I wanted to talk about is heart failure. Heart failure is incredibly common. If you don't develop heart failure, someone you know will develop heart failure. I think it's very important that everybody has at least a little bit of understanding of what this is, because not only might you have it, but you might be caring for somebody that has it, or at least have a friend that you're cooking a meal for, and it would be important that you at least know a few things about this. So basically there's two types of heart failure. There's diastolic and systolic, which are just smart sounding ways of explaining what's going on. With diastolic, the problem is that the heart can't fill. So basically your heart's a pump that fills up with blood, the muscle squeezes down, and the blood gets perfused out to the body. The problem with diastolic heart failure is basically the chambers, the muscle walls of the chambers fill up so much that it's not able to actually fill with blood. The problem with systolic heart failure, which is generally a little bit more common, is that those chambers become so thin that the heart muscle isn't as strong and can't push out as much blood. So they're both important. The problem that we see the most often with diastolic heart failure is people will have a lot of swelling in their legs, which can cause a lot of weight gain, can cause a lot of issues with quality of life, and eventually can also cause issues with their heart's actual function. Versus systolic, a lot of times what we see is a lot of fluid buildup back to the lungs, so we see a lot of shortness of breath. They're both heart failure. The treatment for both of them is very similar, but they're just slightly different in kind of how they manifest and the reason why they initially start. Signs of heart failure, the most common sign is shortness of breath, especially with systolic heart failure. Fluid buildup is also very common. This is a lot of times when we see people with very large swollen legs. Persistent coughing or wheezing, this is again because there's a lot of fluid in the lungs, irritating them. Tiredness or fatigue, if your heart's having to work overtime to push out this extra fluid and your whole body's having to work overtime to carry around this extra fluid, you're going to find that you get fatigued more easily and just don't feel like you have as much energy. Sometimes your heart will try to overcome some of this by increasing your heart rate. So sometimes you'll notice that you have a high heart rate. Nausea or lack of appetite, especially if you're working to constantly breathe. It's tough to be able to feel like you want to eat anything when all you can really do is catch your breath. And then when this gets really bad, a lot of times we'll see people that will get confused. And that's basically a symptom that they're not getting enough oxygen to their brain. So what should you do if either you're worried that you might have this or you're worried that somebody you know might have this? I would say the number one thing is to go in for evaluation with the physician. One of the more important tests that we do to diagnosis and really kind of pin down which type and what severity is to do an ultrasound of your heart. And that'll give us a really good idea not only of the efficiency of the heart, but also the thickness of the walls If any of the walls aren't moving, which is a tip-off for us that you probably have had a heart attack in the past, and also lets us look at the valves of the heart, which can contribute to both of these issues. Once that's kind of established, one of the common things is that we'll tell patients to try to reduce their sodium. Sodium is a common component in what we normally will just call salt. It's usually sodium chloride makes up the vast majority of salt. But sodium is found in a lot of other foods that isn't salt, and at sometimes really, really high quantities, kind of the hidden sodium. The problem with sodium is inside your blood vessels, sodium attracts water and attracts fluid. And so it causes an increased buildup of pressure in the vessels. It doesn't let your kidneys do what they're really supposed to be doing, which is filter out a lot of that extra fluid. And basically you get into one of these states where you have fluid overload. And that fluid ends up going somewhere that's not productive, like your lungs or like your feet. Gradual activity, and what I mean by gradual is activity is really good, but again, I have a lot of patients that will go from not doing hardly any activity to they get really excited and they way overdo it. And then of course they feel terrible, and so then they go back to doing nothing. So really important to gradually increase activity so that your body has time to adjust to this, your heart has time to adjust to this, and this fluid has time to gradually work its way out. Cardiac rehab is kind of the hallmark of what we do a lot of times with trying to do exercise and rehabilitation to get your heart stronger. Medications can be incredibly important. One of the common medications is Lasix. So Lasix is a water pill that will cause you to urinate more of this water out. The reason that it's called Lasix originally was because it lasts 6 hours. So basically it's a short-acting diuretic that will keep you in the bathroom for a couple hours, but overall won't wreck your afternoon if you just take it in the morning. There's other medications that last longer. The advantage of that is it's not quite as dramatic, so you'll be in the bathroom more often, but not every 10 minutes, but they do last longer throughout the day. Modifying risk factors to prevent further weakening of the heart or thickening of the heart muscles is another thing that we really focus on when we see patients with this. And one other thing that's incredibly helpful that I should mention is compression socks. So one of the other big things that we fight against as human beings, as we get older, even when we're younger, is gravity. Okay, so gravity tends to pull the fluid down, it's down in your legs, it's hard to get back up. With compression socks, we can give just a little bit of push to get it back in your bloodstream, back up to where it needs to go so that your kidneys can filter it out and your heart can pump it through. It's important to realize that heart failure is a chronic disease. What I mean by that is it can be treated, and it's not something that necessarily goes away, but I have plenty of patients that with a little due diligence, a medication or two, can really enjoy everything they want to in life despite having heart failure. I've never really liked the term heart failure because it sounds so dire. You're mixing a term that we all know the heart's important with something like failure that just sounds terrible. I haven't really come up with a better term for it, otherwise I'd start using it, but it's really pump failure then, and you can improve the pump, you know, by getting some of the fluid out, by strengthening the heart muscle, by using medication. So it's something that many people live many years with and do very well with, but it's also something that if you ignore it, will definitely rear its ugly head. So two other terms that you guys might hear is valve stenosis or valve regurgitation. So you have heart valves throughout your heart between the different chambers. So you have 4 chambers in your heart. In the top you have 2 atria, and their job is really to initially kind of fill with blood and put that blood into the ventricles. The ventricles are on the bottom. They're the more muscular component, and their job is actually to provide the pressure to push the blood throughout the body. The right ventricle pushes in through the lungs and back out into the left atrium. The left ventricle pushes out through your entire systemic body system. Between each of these atria and ventricles are different valves. If those valves are too tight, it can cause problems. That's called stenosis. That can increase pressure in certain chambers and cause them to expand. If they leak backwards, that can cause problems too. There's been phenomenal technology on fixing this, especially over the past 5 to 10 years. They can actually replace a lot of these valves now, not by open heart surgery, but by going through the artery in your body, up catheterizing your heart, and actually deploying a new valve. So it's pretty amazing. The reason that I bring it up is that sometimes these things are a little bit more difficult than just simply modifying salt, or I mean, it can be a structural issue, but again, it can be seen with ultrasound, and there's a lot more treatments that aren't quite as dramatic as what they were 10 to 15 years ago. So what causes your heart to have these issues? This is the part where you kind of figure out what you can do to never have to deal with these things. So your parents, our parents give us a lot of things, including our genes. And our genes tend to determine a lot of what happens later on in life, especially when it comes to your heart. Your habits, activity, what you do on a daily basis. People that have more of a sedentary lifestyle are at much, much higher risk for heart-related issues. Diet, what you eat is very important, and we'll talk more about that, especially with cholesterol and sodium. And then smoking. And I listed it 3 times because it's so important. Smoking does a lot of bad things to your vessels, which in turn does a lot of bad things to your heart. One thing that's really good, though, that I'm really actually excited about is actually there's been some new state surveys that show that tobacco smoking in Minnesota has decreased down to 14% now, which is phenomenal. High schoolers now are smoking less than 10%. Both of these are the lowest it's ever been. I have a ton of patients that are former smokers that have figured out ways to quit. We have more options than we've had in the past to help people quit. So what I always kind of tell people is it's good to come in and talk about. Hopefully we can find a solution that works for everybody. One interesting thing about quitting smoking is most things that you do in life, if you don't succeed, the odds of the next time succeeding are smaller than the first time because people get discouraged. But when they've done studies on tobacco smoking, actually every time that a person quits smoking, they're more likely the next time to succeed and to stay away from tobacco for longer. So it's kind of a cumulative effect. So when people come in and say, yep, I started smoking again, great, we just get back on the horse. You got a better chance this time than you did last time. So how do these things kind of play into some of these processes that I was talking about? So cholesterol, you kind of saw with the heart attack, it builds up on the inside of the lining of your vessels. It can rupture and cause a heart attack right now. It can also make your vessels smaller, which can cause you to have the more stable kind of angina that I was talking about, where you get the chest pain every time you get to a certain heart rate or heart level. The other thing that it can do is it can kind of stiffen those vessels. And that's really the big issue with high blood pressure, is your vessels are actually made to expand and contract, and as the heart beats, they expand and contract a little bit. But with high blood pressure, like anything, if you think about anything that tends to expand and contract, if it gets too much pressure put on them, the garden hose is a great example, it'll get stiff. When it gets stiff, your blood pressure goes up. Diabetes actually plays a huge role in this as well. Diabetes leads to elevated blood sugar circulating throughout your body, which again can lead to vascular disease, and specifically with diabetes leads to kidney disease, and your kidneys are a big component of your blood pressure. If your kidneys aren't working well, it tends to raise your blood pressure, which then kind of causes that cascade of events. So for cholesterol, how to get better cholesterol or prevent bad cholesterol? Probably one of the number one things is genetics, but we can't do anything about that. So that's just something that we need to monitor. But fortunately or unfortunately, there's some of us that can eat anything they want and will have a phenomenal cholesterol profile because they got lucky with genetics. And there's other people that can eat exactly what we tell them to a T and will still have high cholesterol. But the things that we can change are what we eat. In general, if we eat low carbohydrate and low saturated fat foods, we'll see an improvement in our cholesterol profile. Cholesterol is made up of a few different types of components. One of them is called HDL. That's good cholesterol. So the easy way to think of that is it starts with an H, so we want it to be high. It's really good. Actually, if you have a high HDL, it takes away one other cardiac risk factor when you look at what your overall risk is for heart attacks. LDL stands for low density. We want that to be low. That's the one that tends to cause problems. And so what we found is rather than looking at total cholesterol, which is how we measured everybody 15 years ago, it's more important to look at what's the ratio of that LDL cholesterol compared to the HDL cholesterol. If you have high cholesterol but your HDL is 100, you might have much better cholesterol than somebody who has normal cholesterol, but it's all made up of that LDL component. Your weight plays a big role in this, so trying to maintain a healthy weight. And then this is one of the things that we actually have a pretty phenomenal medication. So statin medications were originally developed to lower cholesterol to make these lipid profiles look pretty. Okay, there was some studies that were put out there that arbitrarily chose a cholesterol level and then went through and found that people at this certain cholesterol level had much better outcomes when it came to heart disease. Subsequently, what they found was more important wasn't even so much the level, it was just whether or not they were on this statin medication. When people take statins, their heart risk in general, and this varies based on your risk factors, tends to be cut in about a half, which is actually a really big number compared to a lot of medications we use. A lot of medications cannot give you anywhere near that much of a benefit. The common side effect of this medication, when I say common, I mean maybe less than 5% of people, but common enough to where I tell people when I put them on it, is that they can get pretty extreme muscle aches. If the muscle aches get severe enough to where there's muscle breakdown, we take them off it. We can check this through lab testing, so we just have people come back to check these labs. But it's overall rare, but it's the most common side effect. There's been some concern over whether statin medications are linked to dementia later in life. So far that hasn't been conclusively proved by anything. It's a medication that now we've had around for a number of years. I think it's probably been 25 or 30 years since some of the original statins like simvastatin were developed. And we haven't seen this dramatic increase in those people having issues. By the way, one of the most common reasons for dementia is vascular disease. So that's the other thing. Even if the medication does have some extra component in it, you're also saving people from a lot of vascular disease, TIAs, and strokes that can cause a lot of dementia as well. High blood pressure, probably one of the most major contributors to high blood pressure is weight. Many people, if they gain 20 or 30 pounds, will become hypertensive, and if they lose 20 or 30 pounds, will at least be able to lower their blood pressure. 10% of your body weight is kind of the goal if you're trying to make a big impact, whether it's on blood pressure or diabetes. That should be a goal over 6 to 12 months. I've had a lot of patients that will lose a lot of weight in a very short amount of time. The problem is they can't sustain those changes in their lives and will gain it back. So I really kind of try to convince people to look at it more as a marathon, as to try to lose a pound a month just through kind of simple things like we're going to spend more time on the outer ring of the supermarket than on the inner area of the supermarket, or we're going to walk every day for 10 minutes. You know, we're not going to try to go run on the treadmill for an hour, but just for 10 minutes, but we're going to do it every single day. And over the course of 6 months, you'll start to see benefits from things like that. Activity can have a huge impact on high blood pressure. We see this with exercise that reaches people's kind of target rate, so cardiovascular exercise. The easiest way to figure out what your target heart rate is to take 220, subtract your age, so 220 minus your age, multiply that by 0.8 and by 0.6, and that's the low and the high, right around that area. There is a more calculated measurement that takes your resting heart rate. If you have a computer, go on there and just calculate target heart rate. It'll ask you for what your resting heart rate is. Check your pulse a few times when you're just sitting there, average it out. Enter that, enter in your age, and it'll spit out numbers for you. For most people, it's going to be somewhere between 100 and 140. Okay, and that's the heart rate that you want to be at when you're exercising. So even simpler than that, though, if you want to know how intense to exercise, because this would require you to check your blood pressure, have some monitor, is that if you're exercising and you can talk in a normal sentence without having to even take any stops or anything, you're probably not at your target heart rate. If you're exercising at a point to where you can't finish a sentence, you're beyond your target heart rate. So it's basically exercising at a rate that you can't hold a normal conversation, but at the same point you're not so out of breath that you have to stop what you're doing to say just a regular sentence. Diabetes is really important in heart disease. It's really important to check if you have it, to control it if you do have it. The big name of the game for 90% of diabetes, which is type 2 diabetes, is weight management and carbohydrate intake. So what I mean by that is fat tissue makes insulin not work, or at least not work as well. And so when people gain extra weight, your body has to make that much more insulin to get the same effect, to get the sugar out of your blood. When people lose weight, we tend to see that they don't need as much insulin, which if done early on in this process means they don't have diabetes. Later on in the process, at least can save them from complications and sometimes help them get off certain medications. So weight management, really important with diabetes. Carbohydrates, that's kind of the fuel of the fire. The more simple carbohydrates you eat, the more spikes you're going to see in your blood sugar. All foods can get transitioned through your body's metabolic system to glucose. But what we see with simple carbohydrates is the biggest peaks, and then we can see valleys, both of which can be dangerous in diabetes. Activity will help use up the glucose, so that's a very good thing, but again, it's best to do things gradually. If you have diabetes and you decide one day that you're going to go run for 4 hours and you've never done it before, there's a chance that you could actually make your blood sugar too low, especially if you're on certain medications. So it's important to try to keep your day as normal as you can in terms of I eat 3 meals, I eat generally, it doesn't have to be the same food, but the same amount of food or general types, and I'm exercising about the same amount. There are a lot of medications for diabetes. They work well. However, probably the biggest mainstay for diabetes is also one of the first medications we've ever used for it, and that's metformin. Metformin is one of the few medications that will not give you low blood sugar. High blood sugar is very dangerous over the course of many years. It's dangerous for your heart, dangerous for your kidneys, for your vision. Low blood sugar is dangerous today. If your blood sugar goes down too low today, you can pass out, you can lose consciousness, you can have issues today. When I say low blood sugar to that degree, I'm talking 30s, 40s, 50s. I have some patients that will come in and they'll have blood sugar of 65, which makes them feel poorly, and I'm not saying it's good, but at the same point, the thing that worries me more is when I see people that are dipping even below that. The other medications all work, but they're basically taking what would be your normal blood sugar highs and lows, and they're lowering both of them. Okay, so if we want your range to be here, metformin kind of takes it and goes like this. It doesn't really change those low blood sugars, but it changes the high blood sugars, versus the other ones just lower both of them, which can potentially get you into problems with low blood sugars. The problem with metformin is it can have an impact on your kidneys, and diabetes can have an impact on your kidneys, so sometimes people with diabetes later in life can't use metformin for that reason. The other problem is it can cause some nausea and some diarrhea. If we started at low doses and are gradual with it, most people can tolerate. Not everybody, but most people can. So that's a big one with diabetes that we usually try to get on board, even with insulin, because again, it makes that insulin work better. So then it kind of gets back to, again, we've talked a little bit about exercise, about how to get into that productive cardiovascular heart rate. People ask me the amount of time they should exercise for. Ideally, I'd love to see people exercising for 30 minutes every day. That's a big challenge when people are starting out. To start off with, especially with busy lives, I like to pick 10 minutes. Most people can find 10 minutes to do something, whether it's go for a walk, that's simple, even if it's coming up to the gym. Start off small and build on that rather than start big and get discouraged. When it comes to a lot of heart issues, again, which are related to blood pressure, things like heart failure, a lot of it comes down to fluids and pressure. There's a pretty robust debate going on with salt, just like there was with cholesterol. We kind of went from telling everybody that all cholesterol was terrible now to everybody's back to eating bacon and eggs and breads are terrible, and which again, one of the biggest things of medicine that I want everybody to kind of understand is it's sort of like a pendulum. It swings to one far extreme, then to the other extreme, and the truth is usually kind of somewhere in the middle. Moderation. Exactly, and so when we find something's good, it's not necessarily to take that good thing and do 3 times of them, because you're probably getting out in a range that there's going to be an unintended consequence. So we've known for a while that salt can be dangerous, specifically sodium. But now we've actually seen a little bit of a swing the other way, where we've seen some increase in iodine deficiency. So regular table salt is fortified with iodine. We need a certain amount of iodine in our body for actually our thyroid health. If you look on most of these, they'll say iodized salt right on the top of them. So there's a certain amount of benefit to salt, but for most Americans, we're eating twice as much salt as what we should to get any benefit, to the extent that we're getting relatively significant consequences. So I kind of wanted to walk through how much salt, or sodium specifically, is in common things that we eat, and kind of point out some things where there's a lot of hidden salt, and maybe some areas that don't have quite as much salt as what you would think they would. One other thing that I've had a lot of people ask me is, what about sea salt? Is sea salt good? That must be so much better than regular salt because it's not processed. For the most part, salt is salt. You're exactly right. The one thing that sea salt, or pink Himalayan sea salt, has is they have a little bit more micronutrients in them, because they're not processed as much. Micronutrients aren't bad, they're probably good, but again, if you have heart failure, especially salt is salt. Kosher salt and sea salt are a little bit more flaky, if any of you really like to cook a lot, which does mean that if you take the same volume of salt, there will be slightly less sodium in it, but for the most part, salt is salt. Low sodium salt, which sounds like an oxymoron, is where they actually take the sodium and replace some of it with potassium. The problem with that is a lot of times when people have high blood pressure, heart failure, we put them on medications that specifically, or it doesn't mean to raise their potassium, but it causes more potassium to get absorbed through the kidneys back into the bloodstream. So I don't necessarily want people to overload themselves with potassium instead of salt. That can be just as big of a problem. Kind of looking at a few of these things. So are you familiar with kind of what the US daily value, how that works on a food label? 100% is what they recommend that you have. For salt, it's just a little bit under 2 grams or 2,000 milligrams. It's a little bit easier to add up the percentages to 100% for a lot of these things. So I put a label over here on the right. This is something that I love and is probably the worst thing in the whole grocery store to eat. Can anybody guess what would be this terrible? Obviously, it was on a can, I'll give you that. So it's a canned food that has 50% of your daily saturated fat in a serving, so it's not even the whole can, and also has almost 50% sodium. Close. It's like Spam mixed with salt and little chunked up potatoes. Oh. Yes, corned beef hash is terrible. And actually the worst part about it is they even have low fat hash and low salt hash, and even that is still terrible. But that being said, I still eat it every once in a while. Again, it's moderation, just don't eat a lot of it. So I've kind of arranged some of these things. Like I said, I'll pass them through, but some of the things at the top actually equal almost your whole daily value of salt. So a teaspoon of salt, that is quite a bit of salt. Most people aren't going to put that much on something, is your total daily value. One of these cans of chicken noodle soup, if you ate the whole can, is your total daily value of salt, essentially. Tomato soup's a little better. This is like half. You know, if you ate this whole can, it's about half your daily value of salt. Another one that has way more salt than what you'd realize is spaghetti sauce. The nice thing about some of these is you can actually make some of this stuff and make it either salt-free or almost no salt-free. Vegetables, canned vegetables are high. This one, I actually couldn't find a canned vegetable that's high because we tend to can a lot of our own vegetables, and my wife had happened to buy the no salt added. But a trick for you on canned vegetables, almost all the salt is in the liquid. So if you drain it, throw it in a tight colander, rinse it off, you can get rid of at least half the salt. Black beans or any beans in a can, almost anything in a can, you got to check it. Some of it's not so bad, but about 75% of it tends to have a lot of sodium in it. The other big thing to not forget is condiments. So a tablespoon of this is half your salt, if I remember right. Yep, half your daily salt. So you know, you'll get the little packets at the restaurant, and just one of those packets can give you half your salt. Ketchup, this is about 10% of your daily salt, but again, in Minnesota we use this on just about everything. So keep that in mind. Another thing that can really push you over on salt is cured meats. So salami, 4 pieces of salami has like 50% of your daily salt. So salami, sausages, any type of processed meat, they cure it with salt. The reason they do that is because once upon a time we didn't have refrigeration. We have it now. I know it tastes good. I like it, but it's not good for you. Nuts actually aren't quite as bad as you'd think. So a handful of nuts is actually about 15% of your daily salt. I'm not saying it's good, but compared to a lot of these things, it's not as bad as you would think. So nuts have kind of gotten a little bit more of a bad rap, probably, than what they should. One of the biggest ones, I would say, above all of these, is pizza, especially pre-prepared pizza. So this pizza, which granted most of us wouldn't eat the whole pizza, but this pizza, a fourth of this pizza is going to give you a third of your daily sodium, which isn't really a ton of pizza. This is a strong runner-up to my corned beef hash. So this gives you a quarter of your saturated fat, a third of your sodium, and also a ton of simple carbohydrates. again, most of us don't eat the whole thing, but I eat a half of one of these. You know, so all those numbers I just told you are doubled when I eat it. You know, so I mean 2/3 of almost everything I should eat that day. And obviously I'm going to need to eat a few meals. The other big thing is any sort of boxed pasta or boxed rice tends to be very high in salt, but the actual rice and pasta are not. So again, if you make pasta, usually it's pretty good. It's that they want to sell their product, and generally speaking, our taste buds are tuned to salt and fat. All right, so again, like I said, I'm not saying to do zero salt. I have more of a problem with sodium than salt, which is sodium's in salt, but at the same point, 9 out of 10 Americans, however, consume too much salt. So most of us are on the far end of the pendulum. We need to swing back, do less processed foods, less salt. Most of my patients are great about not adding salt. That's pretty easy for them because, again, conceptually, it's just you throw the salt shaker away. But they really struggle with boxed foods because they're easy to make, especially if you're in a situation where kids are gone and, hey, there's just 2 of us, or maybe there's just 1 of me. To go to the effort to make this whole big meal from scratch is really difficult. What I would say is think of it as sort of an adventure. You got 16 hours in your day, spend 2 of them cooking. If you start doing it, you'll be amazed at how fun it actually is, even though at the beginning it seems impossible to find the time. That's the difference. In a lot of cultures, actually preparing the meal is an event that really they look forward to, versus us, we kind of look at it as a, you know, something we don't have time for. 65% of most people's salt comes from supermarkets, which is pretty easy for us to fix. Again, stay around the outside, don't go in the middle nearly as much. 25% is from restaurants. That's more difficult because you don't really know what's going to be in there. Fast food is kind of terrible for salt content, but even restaurants can be really high in salt. Most places, if you let them know that you're trying to eat a low salt diet or that you have an issue, will either have selections on the menu or be able to prepare something without salt or low salt for you. So don't be afraid to ask them. Again, 30% of people have issues with with vascular disease in their heart to where they need to be on low salt diet. You're not the only one in the restaurant that day that needs to be on low salt. 10% comes from other sources. So the recommended AHA amount is 1,500 milligrams. I think the USDA is slightly higher, more around like 1,900. But again, you're under 2 grams for most people. Most people are over twice that at 3,400. Not only does it increase your risk for heart failure, as I talked about, but it increases your risk for stroke, osteoporosis, certain cancers, headaches, kidney stones. Also increases water retention. Nobody likes to be bloated, nobody likes to be puffy, and nobody likes to gain weight for no good reason. So one more thing that I just wanted to kind of mention, because I have a lot of patients that come in and ask me about it and will get really worried about it, and I think it's helpful just for people to kind of have at least somewhat of an understanding of what this is atrial fibrillation. So this is a common heart condition that basically is where the atria, remember those are the ones that are supposed to fill the ventricles, aren't operating in sync anymore. So the atria are supposed to contract to fill the ventricles, then they contract and it goes out to the parts of the body it's supposed to. So if the atria are kind of fluttering or not fully contracting, the ventricles don't feel quite as good, it's not quite as efficient. But that's not even the real problem. That little loss of efficiency, 98% of people, not going to be a big deal. The problem is that the atria, because they kind of quiver and quake, they never fully empty, and you can develop a blood clot inside those atria. That blood clot then can go to certain parts of the body that are not supposed to have blood clots. Not that any place is good to have a blood clot, but certain areas like your brain are especially susceptible to this. So that's the real risk, is the blood clot. The other problem is that even though they're not operating in sync, if your atria are basically rev up to the extent that your ventricular heart rate gets above a certain rate of, say, usually for most people it's 120 or 130, they can be going so fast that they don't even have enough time to fill. And that the coronary vessels that go around and supply the muscle that's working so fast doesn't have enough time to get enough blood flow. And that can cause symptoms of chest pain, shortness of breath, and even lead to things like heart attacks. So really with atrial fibrillation we have 2 goals. Prevent blood clots, keep the rate down at least, in the range of less than 100 hopefully, or 105, something like that. So we use a couple medications specifically for that, blood thinners. And now they've developed some newer blood thinners that don't require testing like Coumadin has for so many years. And then we use medications to keep the heart rate, kind of put a governor on the heart rate. There are things that cardiologists can do to try to shock your heart back into normal rhythm. There's other medications that can try to hold a normal rhythm. I'm not saying those things are bad, but for the vast majority of people, as long as you control the big risks, they might even be further ahead, because if a tree falls in the forest, you don't hear it, you might have a normal heart rate for 6 months. It might go into an abnormal rate for 3 weeks. You have no symptoms, and there your clot builds up. So I just kind of want to show you a graphic on this. So this is how your heart is supposed to beat. So see, these areas constrict, they go down to here, there's a very slight pause, and then the ventricles contract and it goes out through the great arteries into your body to perfuse those areas. What happens in atrial fibrillation though, these top atrium are just kind of quivering and beating at a very irregular rate. It's not as efficient to fill the ventricles, but the bigger problem is that you can get blood that kind of pools in here and eventually forms a blood clot. And then it sits there kind of like a ticking time bomb. Coumadin, what it does is it thins your blood so you're less likely to form a clot. The problem is you're more likely to bleed, but when you look at a lot of people that have atrial fibrillation, we can take their risk of a stroke and bring it from 6 or 7% down to 1 or 2% with Coumadin. All right.